Getting into Adi Shuhu Primary Hospital in southern Tigray, first thing you notice is the empty beds. Dr. Goitom Girmay, medical director, explains that the beds were previously occupied with patients getting medical care, but since there is no medicine, especially intravenous medication, there are no inpatients anymore.
We have no intravenous medication which would have been given through injection. Hence, beds are empty. Even the occupied ones have no fluids, bed sheets or anything, just mattresses.
Dr. Goitom and his colleagues explain the nightmare which has become their daily experience as medical personnel in Tigray. They say that the patients are dying in their hands, while they have the skill to treat them, but completely unable as there is no medical supplies to use. As a result, mothers dying while giving birth at home, and emergency patients are suffering from easily treatable cases for there is no oxygen to give them immediately.
Simple medications given at emergency center for emergency cases are non-existent. There is no oxygen and no electricity. Hence, patients, including babies, die on a daily basis.
Coordinator of the Maternal and Pediatric Unit, Mr. Adi Shuhu, states that pregnant mothers are dying while giving birth due to lack of medical supplies. Most of the mothers don't even bother coming to the hospital because there is nothing more they can get than giving birth at their home.
Our biggest challenge is giving care to newborn babies, especially those who are under 28 days, because there is no medicine. Even some of them are delivered at home, then brought here after their health condition deteriorates.
Mr. Guush Fissaha, General Manager of the Primary Hospital, and Dr. Gabrakiros Tesfai, on their part, explained that even if you figure out the complications from which the patients are suffering, getting the treatment is impossible. Patients suffering from chronic disease are also not getting any kind of care.
It's very distressing to say there is no medicine to a patient after he had figured out the complication in written prescription. Our patients understand the problem that we all are in, so they just thank you for your service and go home to die.
Patients suffering from chronic illnesses such as diabetes and blood pressure are in a terrible situation. There is no medication or treatment being provided. As a result, we are losing many patients.
On top of this, the health professionals haven't been paid their salary for more than 9 months, which is making their lives even tougher. The health professionals describe their situation as devastating and that they and their family members are starving.
We have no salary. We are suffering and starving.
As medical professionals here in general, we are under immense suffering and starvation.